drug user is a danger to himself and to others. When compared to a person who does not take drugs, a drug user is over 3 times more likely to be injured or to injure another person in an accident. And that's not all.
The drug-using employee is also 3 times more likely to be late for work and 2.5 times more likely to have absences of 8 days or more. And you know that lateness and absenteeism pose serious problems in running a transit system. So, drug abuse costs dearly in terms of life and health, and in terms of lost productivity, which is over $100 billion a year. As a transit supervisor, you know firsthand the human and financial costs associated with drugs. They are unacceptable to you and to the industry, and you have a key role in helping the industry achieve its goal of a drug-free transit workforce.
This program focuses on what's called reasonable cause drug testing, especially as it relates to the performance of employees who are involved in sensitive safety functions.
And the program was developed specifically for you, the frontline supervisor, because you are the person most likely responsible for initiating a reasonable cause drug test. The program presents information on the 5 most commonly used illicit drugs and their effects, and on the short-term and long-term indicators of drug use that could trigger a reasonable cause drug test. The program is designed to help you by addressing ways to initiate the drug testing process for reasonable cause, and by defining methods to substantiate the need for the test and for documenting the circumstances leading to the test.
And finally, you'll learn techniques for approaching and interacting with the employee who you will be referring for a reasonable cause drug test. Let's start with a discussion of reasonable cause.
Reasonable cause for drug testing means that an employee has aroused your suspicion that he or she is using drugs. Your suspicion should be based on facts, circumstances, physical evidence, physical signs and symptoms, or on the observation of a pattern of job performance or behavior. In addition, the facts, signs, symptoms, and so forth should be of a kind that would cause a trained supervisor to reasonably conclude that the employee has violated the employer's anti-drug policy and/or is under the influence of or is intoxicated by a drug or prohibited substance.
That's a lot to grasp. But what it means in part is that your suspicions must be based on particular kinds of indications. A hunch or a lucky guess is not an acceptable basis for a reasonable cause drug test. Also keep in mind, you are not on a witch hunt for drug abusers, which brings us to what your responsibilities are.
As supervisors, you are in positions to make important contributions to the goal of a drug-free transit workforce. You are the people who can detect the problem, who must confront the employee, and who may have to refer the employee for a reasonable cause drug test.
You are a supervisor, not a police officer, yet you are expected to use reasonable cause testing when drug use cannot be ruled out as a possible cause for deteriorating job performance. Supervisors are also expected to ensure that transit employees in sensitive safety positions are fit for duty.
Sensitive safety positions include employees who drive buses and who operate or work as a crew on rapid rail vehicles. They are the personnel who provide support in revenue vehicle operations, such as dispatchers, safety and safety training personnel, and yard and tower personnel for rail operations. They are the people who maintain revenue vehicles and who perform functions such as fueling, oiling, and mechanical repair.
They are the personnel who provide for maintenance of vehicle movement control systems, for roadways and tracks, for tunnels, subways, and bridges, for communication systems, and for electric power facilities. And finally, they are you, supervisors, because you are in sensitive safety positions too.
For a supervisor to determine that drug testing is necessary, he or she must establish reasonable cause. Reasonable cause can be established in a number of ways. One way is by observation of the illicit drug or the paraphernalia that's used with it. Another aspect of determining the need for a reasonable cause drug test is observing and documenting that a person is exhibiting the signs and symptoms of drug use.
Let's start by discussing 5 illicit drugs that are among the most frequently abused. Marijuana, including hash and hash oil. Cocaine, including its derivative, crack. Opiates, which include narcotics such as heroin, morphine, codeine, and other medicinal narcotics. PCP, also known as angel dust, and amphetamines, commonly called speed or uppers. Let's discuss them one at a time.
Marijuana is a green to brown leafy material that resembles oregano. It can be rolled like cigarettes into joints or can be smoked in a variety of pipes. The aroma of marijuana resembles a combination of sweet alfalfa and incense. Please keep in mind that of the 5 drugs we'll cover, marijuana is ranked as the #1 cause of serious workplace accidents and incidents.
The signs and symptoms of marijuana use may include reddened eyes, slowed speech, a distinctive odor on the clothing, a lackadaisical attitude, fatigue, and lack of motivation.
Cocaine is a white to creamy granular or lumpy powder. It is snorted into the nose, rubbed on the gums, or injected into the veins. Common paraphernalia include a mirror or a piece of smooth metal, a half straw or metal tube, and a small screw cap or vial, or folded paper packet containing the cocaine. Crack, which is a derivative of cocaine, is generally smoked in a glass pipe and looks like small rocks.
Cocaine has several signs and symptoms. Because cocaine affects the central nervous system as a powerful mental and physical stimulant, the signs and symptoms of its use may include
unusual defensiveness, anxiety and agitation, forgetfulness, absenteeism, tardiness, missed assignments, and difficulty in concentration may result from cocaine use. Also, physical symptoms of a runny or irritated nose and dilated pupils may be observed. Opiates are narcotics, such as heroin, morphine, and codeine. They alleviate pain and depress body functions and reactions. Opiates may be taken in pill form, or they may be smoked or injected, depending on the type of narcotic used.
The signs and symptoms of opiate use may include constricted pupils, depression and apathy, and impaired coordination, physical fatigue, and drowsiness. Unwanted side effects such as drowsiness, dizziness, mental clouding, and nausea and vomiting place the abuser at high risk for accidents and mistakes in judgment.
Phencyclidine, or PCP, is a tranquilizer with adverse side effects. It's sold as a creamy granular powder and is often packaged in 1-inch square aluminum foil or folded paper packets. The signs and symptoms of PCP abuse include dilated pupils, impaired coordination, severe confusion and agitation, extreme mood swings, and dizziness and a rapid heartbeat.
The potential for accidents and overdose emergencies with PCP is high because of the extreme mental effects combined with the anesthetic effect on the body.
Amphetamines are often taken as capsules or white flat pills. They are stimulants that speed up the mind and body. The physical sense of added energy at lower doses and the mental exhilaration at higher doses are the reasons for their abuse. Methamphetamine is another form of amphetamines that is often sold as a creamy white granular powder, which is taken orally, injected, or snorted into the nose.
The signs and symptoms of amphetamine use are similar to those of cocaine, but are often much more intense and longer lasting.
They include hyperexcitability and restlessness, dilated pupils, talkativeness and inability to concentrate, and rapid respiration.
The stimulation that results from amphetamine use increases impulsiveness and other risk-taking behaviors, including unsafe and potentially violent behavior. Now that you've learned about the concept of reasonable cause and about 5 drugs and their effects, it's time to learn about short-term and long-term indicators of use.
A determination that drug abuse is taking place does not require an overwhelming burden of proof, but must be based on objective facts. Objective facts are based on evidence in 2 forms: short-term indicators and long-term indicators, or a combination of the 2. Short-term indicators are the observable physical signs, such as the drugs or paraphernalia, and the symptoms we just discussed that can indicate drug use. In addition, unsteady walking, poor physical coordination, hand tremors, and combative behavior can be indications of drug abuse. There is an important connection between long-term employee job performance and drug use, which is why long-term indicators are often the most practical and most reliable.
To put it another way, short-term indicators can be misleading and can be difficult to observe if you have limited opportunities to see the employee at work. In addition, long-term indicators can be used to substantiate any short-term indicators that exist. But what are long-term indicators?
They can be described as work performance problems, including a decrease in the quality or quantity of work. Chronic problems with tardiness and absenteeism, increased accidents or injuries, poor judgment, excessive laughing, and difficulty in concentrating on work are a few long-term indicators. Others include personality changes that cause mood changes, or that make a person more aggressive, fearful, anxious, depressed, or suspicious of others. Other signs include a neglect of personal hygiene and a pale or sickly complexion. We call this section of the training program Initiate, Substantiate, and Document, because that's exactly what you must do. To initiate the reasonable cause drug test, you must substantiate the need for the test and document the facts surrounding the need for the test.
We know that long-term indicators of possible prohibited drug use generally occur as a pattern of deteriorating work performance or behavior over a period of time. So, how do we know if performance or behavior is deteriorating?
One of the most important ways is to know your employees, so you can recognize if they begin to change. The next thing is to keep regular track of performance and trends of performance, so that changes or aberrations become obvious. How can you keep track? One of the best ways is to use checklists, one for short-term indicators and one for long-term indicators. The checklists provide a consistent and thorough way to document behavioral changes.
But the checklists alone are not enough. A supervisor must also ask himself or herself 3 key questions to determine if a reasonable cause drug test of an employee is justified.
First, are there objective facts that point to possible drug-affected behavior? Second, would another similarly trained, experienced, reasonable, and prudent supervisor have come to the same conclusion, given the same observed signs and symptoms? And third, would you, the supervisor, be making a less responsible decision if you decided not to require the employee to submit to a drug test? Notice that the information documented on the checklists helps you answer each of these questions. If you can answer yes to all 3 questions, then your decision to have the employee take the drug test would normally be considered to be justified.
Depending on your employer's policy, you may also be required to substantiate your decision with another trained supervisor. Now, this is where the checklist can also be very valuable. In addition, a complete and thorough report would also include information about what finally prompted you to initiate the reasonable cause drug test, the reaction of the employee during conversations with you, and any other information pertinent to the situation.
Once you have made the decision to confront the employee, you must be very cautious in your words and deeds. You must avoid diagnosing any employee's problem as drug abuse. Remember, you're not a drug expert. Your role is to determine if there is enough evidence to justify a drug test. Your decision must be based on the types of objective facts we discussed, and especially on those long-term indicators having to do with safety infractions and attendance. Therefore, as a supervisor, you must avoid accusing an employee of having a drug problem. You also should avoid putting in writing a blanket statement that any employee has a drug problem, and you should not try to get a confession of drug use. Again, that is not your role. You must also respect the employee's privacy and rights to confidentiality, so don't discuss your concerns or suspicions with any other non-supervisory employee. And you should use the guidelines we discussed to make sure that unfit employees, regardless of the reason, do not work. An unfit employee should not operate any equipment or jeopardize the safety of fellow employees or the public.
To sum up this section, by knowing your employees, by knowing the indicators of drug abuse, by documenting job performance, and by taking action when it's merited, you will be able to fulfill your responsibilities as a supervisor.
In this portion of the training, we'll cover what you must do to approach and interact with the employee for whom you've established reasonable cause for a drug test.
You can and should approach and interact with the employee in a way that will minimize the potential for conflict.
First of all, keep in mind that an aggressive confrontation style is not necessary. Second, choose a private area for approaching the employee. This will minimize the embarrassment to the employee and help guard his or her right to confidentiality. Third, inform the employee that he or she is being required to submit to a drug test for reasonable cause and will be transported to and from a collection site. Fourth, be sure to point out that the test is only to confirm that he or she is fit for duty. In other words, to confirm that he or she is able to properly perform a sensitive safety job. Point out that the test is not being requested to prove that there is drug use or to prove that there is a continuing problem with drugs. Once again, keep in mind that a confession by the employee is not necessary and should never be solicited.
Requiring an employee to undergo a reasonable cause drug test may result in a number of reactions by that employee. The employee may deny any drug use or may argue that he or she is fit for duty.
The employee may argue about the circumstances that have led you to decide a test is necessary, and the employee may even refuse to take the drug test, even though he or she knows that a refusal could result in termination. Of course, the employee also may be very cooperative. He or she simply may not care, or may even welcome the opportunity to deal openly with a problem. Fifth, you should ask the employee if he or she has any questions about the circumstances that prompted the need for a test. And you should allow the employee the opportunity to offer any explanations that he or she may wish to offer. But you should avoid any lengthy exchange of accusations. Next, transport the employee in as inconspicuous a manner as possible to the collection site, where the employee's urine sample is obtained. The sample will be sealed and sent with a chain of custody form to the laboratory for analysis. Then, transport the employee back to the worksite or home, depending on your employer's policy. In conclusion, Drug testing for reasonable cause is part of your responsibility to the public to help assure users of public transportation and fellow employees that safety continues to be an overriding goal of the transit industry. You, as transit supervisors, have the responsibility to ensure that sensitive safety employees under your supervision are fit for duty. Reasonable cause drug testing is considered a valuable resource available to you to help fulfill that responsibility.